So first of all, let me thank Tampere University and specifically Tina and her team for organising this workshop and for the invitation to participate. It really is lovely to be here. As said, I'm a member of the WHO Assistive Technology team, and we sit within the Division of Medicines and Health Products, and I'm based in Geneva at the World Health Organization headquarters. And so my focus in relation to this conference is on the assistive products that people may use to manage their continence. However, a physical product is just one part of the picture. And so I was really pleased to see when preparing for the workshop and also hearing today that this is very much recognised in the concept of this workshop. And so really I'm looking forward to being a part of the conversation and the discussion this afternoon and tomorrow. Assistive technology is a very broad topic, and it involves the whole ecosystem that surrounds successful access to the many different products that are part of the assistive technology family. We group assistive products into 6 groups, 6 functional domains, and self-care is obviously the most relevant to this workshop. As you can see from the slide, within self-care, we include products that enable people to go to the toilet with dignity. And that might include catheters and absorbents and toilet chairs. Self-care products also include shower chairs, eating, drinking, dressing aids, and environmental adaptations, for example, to a bathroom, would also fall within this group. WHO recognises access to assistive technology as a human right, and we promote the integration of assistive technology services into all tiers of health systems wherever possible. Our mandate is to provide technical guidance and support to WHO member states, including through the development of normative documents such as procurement specifications, training, guidelines. On May 16th, we will launch the first global report on assistive technology, which will show that the need is greater than previously estimated, of an estimated 1 billion of the global population needing assistive technology. But we can see from the data that that is actually larger. You have to wait till the 16th of May to hear the actual figure. And we can also confirm in the global report that the need is rapidly growing as populations age. And yet, we are all of us in this room, aware that there is considerable global inequity when it comes to access. The greatest unmet need is in low and middle income countries where health resources are scarce, awareness of available products is least, and poverty is greatest. Even more concerning is that our data tells us very little about the need for continence products. For the global report, we have relied on population surveys. However, we know that people are unlikely to self-report a need for continence products. We have also used information from governments. However, again, we know that health providers in low and middle income countries frequently do not identify or collect data about continence. However, my 30 years' experience working in low income countries and liaising closely with colleagues who are in the front line of health services there tells me that incontinence is a silent issue facing many, including children and adults with disabilities, people with chronic health conditions, and older people. So this is Kerry, and she lives in Papua New Guinea. And in the photograph, she's sharing her challenges with incontinence with a group of primary healthcare personnel, nurses and community health workers participating in WHO's Training in Assistive Products program. Kerry has spina bifida. However, she has never had any formal medical or rehabilitation care that focuses on her incontinence. She and her family have had to manage on their own with limited facilities. She has not had access to catheters, and she uses single-use absorbent products when she can afford them or she goes without. Using single-use products is difficult as she has no means of disposing of the product because there is no rubbish collection in the informal settlement in which she lives. Keeping clean is a constant challenge because she cannot access the bathroom in her home and she has to use a makeshift lean-to on the outside. She can only wash there at night when it is dark, and even then she's afraid for her safety. Kerry's story illustrates the complexity of the issues and the need for solutions that are multifaceted. Successful access to assistive technology requires a system-oriented approach which takes into account the person and 4 other key factors: products, provision, personnel and policy. Looking at these 4 factors one by one in relation to continence. Product affordability, acceptability and availability is key. In Kerry's case, even if absorbent products were the most suitable solution for her, the lack of infrastructure in her country, as in many others, to dispose of single-use products is a huge challenge. So too is having a consistent supply chain to avoid stockouts. At the same time, washable products would be equally challenging, as Kerry has limited access to water and space to dry them. If she had access to catheters, she would still face challenges due to the lack of privacy and cleanliness of her toilet and bathing area, and disposal, of course, remains an issue. She needs a product that is reliably available, affordable and sustainable for her use in her environment. Provision, or the service delivery model which supports people's access to the assistive technology they require, is also critical. For continence products, this must include proper medical diagnosis in the first place to ensure that a product is not provided when in fact medical or rehabilitation care would resolve the problem, and to identify the most appropriate product if needed. At present, our team is working with Kathy Murphy, who's in the room, from Southampton University, to carry out research exploring the experiences of people in Romania, India and Papua New Guinea trialling absorbent washable products. A challenge in this project has been ensuring that people recruited to the trial are in fact candidates for absorbent products rather than another continence solution. There simply is not the health services available with trained personnel to adequately assess and advise people about the most appropriate continence product for them. Which leads me to the need for there to be personnel who are trained to identify who may need continence support, who have the training required to respond appropriately, whether that is a referral, for example, by a health worker at primary healthcare level to more specialist care, or to take action themselves with the safe provision of simple products. I mentioned earlier in this speech that we are running training which is being carried out in Papua New Guinea. And this is part of a broader project to develop online training in assistive products for primary healthcare personnel. And that includes a module on absorbent products with a module on catheters to follow. We've been hugely impressed by the response to the self-care modules from primary healthcare workers, who have reported that they have not previously considered asking their patients about issues with self-care and did not consider that if they did, there was anything that they could do. There is willingness, although without more human resources and the products being available, not a lot will in fact change. Which is where policy comes in, because policy and financing mechanisms are required in order to support the provision of continence products to those in need. Expansion of the scope of health personnel to include assistive technology in general and continence products specifically, as well as there being cross-sectoral issues such as waste management and the built environment. And so my message for this workshop is twofold. In thinking about solutions, keep in mind the 5 Ps: the people, the products, the provision systems, personnel and policy that need to work together in order to create sustainable solutions. And I do think that the way this conference has been set up, we're in a really good position to do that. And secondly, think about solutions that have the potential to be global in reach, that could work in the less than ideal settings that people such as Kerry live in, bearing in mind that 70% of the world's population live in low and middle income countries and 10% live in extreme poverty, where the realities of daily living are very different to what is experienced in high-income countries, where many of us in this room have come from. And just finally, I will point out that the picture on the slide there is Kerry's lean-to bathroom, and I'll leave you with that. Thank you very much, and thank you again for the opportunity.